So when we consider latarjet, we should think about a few questions. That is, one is arthroscopic latarjet or a latarjet a standalone procedure? Is it good enough? Is a remplissage required? And what happens if we do a remplissage? So we understand that latarjet works on the triple concept or the triple effect, which is the extraarticular bone graft, the dynamic sling, and the Bankart effect on the capsulolabral complex, which is being sutured back. We understand the rationale of the latarjet. We understand the stabilizing mechanisms by this JBJ study in 2013, which shows the importance and the contributions of the different structures like the conjoint and subscap, and in the different positions of the hand and different ranges of the hand position. So we also understand here, you can see that in green color, the 23 to 24% by the suture of the that is capsulated repair, and also the importance of the bone graft. We understand that the glenoid size increases to 31 to 35% with the latarjet. My indication of latarjet would be a glenoid bone loss of 13.5 because that's a new number of the critical value. Failed soft tissue Bankart repair, severe capsulolabral insufficiency, increased ISIS or the GTIMS score, and contact athletes. So now when we come to latarjet, we have to talk about its failure, and the failure numbers are 3 to 4.6% different literature, and that is frank redislocations. And relative instability would be like around 13%. So when we delve into the causes, we find that possibly it's because the remplissage is not being done in a Hill-Sachs effect, non-healing of the graft, and it could be a definite possibility that the glenoid can still be off track even after the latarjet could be done. How is that possible? That's definitely possible, as you can see in picture A, where it is off tracking, becomes on track in picture B. But in some lesion, like a centralized lesion, we can see that, or if it is a medialized lesion, we can see that it's still off tracks. Or it is also possible when the glenoid defect is pretty big enough and not able to compensate. So you can see how a centralized lesion here really affects it. Now, I feel that one of the most important concepts to come out is the 2023 paper on the distance to dislocation. The distance to dislocation is the distance from the medial edge of the Hill-Sachs to the medial edge of the glenoid tract. And if the preoperative, the D to D, is less than 8 millimeter, it means that latarjet might not be enough. It might be still be insufficient. It can cause increased instability. I will be trying to prove over the next few minutes in the studies which we have done over a period of time that remplissage is important. So the first study is we introduced a concept in 2020. We've been working on it called as borderline tracking. So in addition to track, we have taken an additional 5 millimeter extra to see what a difference it would make. So here we measure the best fit circle. We do track in the regular method, and the hypothesis is that the glenoid track may not be an absolute value. We need not take it as an absolute value. For example, the shoulder has been taken to an extreme position of abduction, externalization, and even in sudden jerk positions. It might not track, the shoulder might not still go into the track. So we introduced an additional 5 millimeter to the glenoid track. And then we saw that we tried to see is there a significant number of patients who are going to be still off tracking, and if there is an increased vulnerability to dislocations, if you take an additional 5 millimeter to the track. So we selected 15 patients. All of them were preoperatively off tracking. All underwent an arthroscopic latarjet procedure with remplissage with label reattachment. 14 patients underwent Mitex screw system and 1 Artex sensor class system. CT scan was done 3 months postoperatively. Functional outcome of all the patients were done at 3 and 6 months. Here, this is the demographic, but the most important thing was all the patients were preoperatively off tracking. So coming to the results, it was pretty interesting results that we had. So out of the 15 patients who had an off track, it was interesting to see that 5 continued to be off tracking. But when we increase the borderline, that means additionally we put a 5 millimeter there, we got 3 more patients, which means that more than 50% of the patient was still off tracking. It was a very important result which we had. So I was trying to emphasize here that this data definitely shows that Tracking should not be considered as an absolute data. We should think about a possibility of giving a borderline to it or something like a distance or dislocation to it. And here, definitely there is a role of remplissage. The second study we did was using the Arthroscopic encephalograph system. So we continuously did 10 cases. So the encephalograph, we know that the encephalograph tape is passed from posterior to anterior and then back to the from the coracoid back to the glenoid. And this is a technique which we described in 2022. Yesterday we got a mail from JSCS International saying that this 10 case series has been accepted. So this is how the surgery which we do. So we can say that the tape has already been passed from posterior to anterior and back again. And we'll be tightening it with the tensioning system. There's a tensioning system which works. You can see in the picture the coracoid gradually being tightened down. And lastly, we put the knots. Definitely I do remplissage in all these cases. So here what we've done is encephalograph latarjet plus remplissage plus scapular repair. 1 year follow-up for function. CT scan was done at the end of 3 months to assess the healing. So this is the data which we had. But most importantly, we had 3 takeaways. There are 3 graft non-unions. External rotation definitely increased from the preoperative to postoperative value, but not reaching the opposite normal shoulder. None of these patients, now these patients are almost touching 3 years, and this data was given to JCS much earlier. So none of these patients till now have any instability. So again, emphasizing that definitely remplissage would be one of the causes why this patient is still very stable. And under the score, there is no score difference between each of, that is graft non-union and the graft healing. So here, these are the 3 cases which out of the 10, 3 had not healed, but the patient were very stable. Again, emphasizing that remplissage is very important, and this could be one factor why it is still very stable. Coming to the last study, is a 2-year follow-up study of the Laforce screw system. So what we have done is what we done is we measured external rotation in all the patients. And the hypothesis was external rotation is not significantly affected with remplissage. And remplissage with the latarjet definitely improves the stability and has better functional outcomes. So here we have 32 patients, 2-year follow-up. We assessed the pre-operative and the post-operative functional outcomes. So the average bone loss was 17.75. And coming to the results are pretty good. The external rotation definitely increased from 49 to 65. And if you look at the median values, you can see here that it definitely increased from ER, you can see external rotation pre-operative to that is the green ones are the post-operative. You can see a tremendous improvement in the values. And you can see, but none of these values are same as the opposite shoulder. But there is only a 5-degree reduction in the median values. That means say that it's not significant enough. So the takeaway is that the external rotation is not much affected. So in conclusion, I would like to say that recurrent instability of latarjet is a reality. And TAC might not be an absolute concept. And we suggest an idea of a borderline TAC where we take an extra value to take care of this. Irrespective of the TAC, it's better that the remplissage is done for additional stability. External rotation is not as much affected as we previously thought. We recommend that it is always optimal to do combined latarjet with remplissage for optimum results. Thank you so much for this opportunity. And these are some of our results. In India, we play blue.